Jacob Scheckman. This is our show, What to Be, with today's guest, Julie Bailey, who is a registered
Having me.
nurse. Yeah, my pleasure. Julie Bailey is a registered nurse in labor and delivery.
As a nurse, I work in labor and delivery. So what that means is I help moms to have their babies.
And oh my gosh, what is that like? How are there different ways to have baby? I think I was done via C-section.
Mhm.
So where do you step in? How are you helping there?
There's lots of different ways that a mom can have a baby. She can have a baby naturally, without pain medicine. Everybody's labor trajectory is so different. And sometimes a mama chooses to use pain medicine to help them through that difficult time. Sometimes babies are born via cesarean section, which is a surgery where they actually make an incision in the abdomen and they cut through the uterus and get the baby out that way. Sometimes it's a scheduled event, and sometimes it's an emergency thing where we, rush back to the operating room and get the baby out.
Okay, let's say there's a standard, everything's going great from start to finish during this labor. What are your main responsibilities in that process?
Well, so I act as the registered nurse. My job is to be the eyes and the ears for the doctor. And
Okay,
so I assess. I'm constantly assessing. When we have a mom in labor, I have two patients. The mom is a patient, and also the baby is a patient. So we'll have the mom hooked up to fetal heart rate monitors so that we can monitor the baby's heart rate and we can monitor the contractions. Basically, the uterus is a muscle. That's where the baby
okay.
lives inside the mom. And when the uterus contracts, it helps to open up a mama's cervix, and then that allows the baby to come out. So my job is to make sure that mom is safe. Both her, blood pressure can be a huge thing that we watch in a mom. There's something called preeclampsia, which is characterized by high blood pressure. And so that's something that we watch. If a mom is diabetic, we will check her blood sugars often. And we're always looking at the baby's heart rate monitor because that gives us clues about how the baby is doing with the process of labor and if we need to intervene in another way. And so
Okay.
I'm constantly communicating with either the doctor, the midwife, sometimes the anesthesiologist, to let them know what I'm seeing, what is my assessment, and you know, sometimes I request them to come lay eyes on the patient, come to the bedside. Oftentimes they'll just come and around on their own to see how the patient is doing, but mainly I'm the eyes and ears for the doctor.
Awesome. Wow. That sounds intense. First of all, you have a ton of responsibilities.
I can.
So I'm curious, given everything that you described and how in depth it sounds like your knowledge base must be to be able to perform as a nurse here. What kind of training or did you go through or certification did you get to approach the point where you're at now and be able to do this job successfully and well?
Yeah, so the first thing you have to do is get your nursing license. And so there's a lot of different pathways to do that. You can go to, once you graduate high school, you can start taking your prerequisite science courses, and that's usually anatomy, physiology, microbiology, chemistry. And then you can either go into a 2-year associate degree nursing program, or you can go into a 4-year Bachelor of Science nursing degree program. And once you complete that, you take a rigorous exam called the NCLEX. It's a national certification exam. Once that will garner you your certification, your registered nurse. Then you try to get hired. You, you decide what area you might want to work in, and there's so many diverse areas of nursing that you can work in. I do labor and delivery. There's neonatal intensive care that works with babies. There's the intensive care unit. That nurse works with adults who are critically acutely ill. There's OR nursing, where you spend your whole day in an operating room. My best friend is a hospice nurse, and so she helps people that have terminal illnesses. That means they're not going to get better. She helps them pass in a way that they choose to pass in their homes. And
Okay.
so I think it's a great diverse field.
Yeah, it sure sounds like it. I'm curious, how did you end up picking labor and delivery?
Well, I went into nursing school because I had two amazing births, and it was just such an amazing, sacred time and moment, magical, and I wanted to be around that all the time. So that was my intention going into nursing school.
So you went into nursing after you had become a mother.
Yes, yes,
Wow,
I was
wow.
a teacher first.
Oh my gosh, what were you teaching?
I taught fourth grade.
You taught fourth grade. Incredible. And then you went into nursing. And
Yeah,
so you mentioned also that you are going back for your master's degree.
yes. I'm
Awesome. Tell me
going back
about
in
that.
August.
What motivated you to go back for your master's, and what are you hoping to accomplish once you've got that?
Yeah, so I've worked 10 years as a labor and delivery nurse. I don't claim to know everything, but I feel that I've compiled a great amount of knowledge and experience in the field. And I feel like going back and getting my master's will allow me to impact more people and just have a greater breadth of autonomy and
Mhm.
practice.
Yeah, incredible. How would you describe your environment on a normal day? We'll talk more about the circumstances that are going on in our world right now, but in a normal day, uninhibited, what is your work environment usually like?
I work with a team of other nurses. We have a charge nurse, and she oversees the unit. I work closely with the physician, with a medical doctor, as well as a certified nurse midwife, an anesthesiologist, and a pediatrician. Those are the primary players on our team. And a normal day, we come in, we clock in, we go to the report room, we go ahead and we get an overview of the patients that we currently have and what their issues are, medical issues, perhaps how far along dilated is the patient. I often take care of postpartum couplets, so that's a mom and baby who have already delivered their baby. And then we choose our patients, and there's some ratios, some staffing ratios that are involved, so we don't have too much on our plate and we can deliver the safest care possible. And then I go in and I do a head to toe assessment on my patient. I listen to their lungs, I take their blood pressure, I check their oxygen status, I talk to them about what their plans are for pain management. I develop a rapport with my patient. I get to find out who they are, and I that's a way that I can engender trust with them. And because I'm going to be the person taking care of them for the next 8 hours, I really want them to trust me.
Yeah.
Yeah, so
How many of these patients are you taking care of in a day or a week?
in a day, if I have a patient that is in active labor, it's a one-to-one situation.
Oh, wow. Okay,
One
so they get
nurse,
your full attention.
full attention. Yeah,
Wow.
because they may be on some high risk medications that
Uh-huh.
require full attention. Yeah. And when I say one to one, mind you, that's one patient to one nurse, but one patient is actually two patients because there's a baby inside that patient.
Oh my gosh. Wow. Yeah, of course.
Yeah.
Interesting. So I'm curious, what kind of skills have you built on this job that you've found to be most helpful for this career, and that maybe you didn't also expect to build in this area?
Um, we do simulation training, and we practice a lot with communication during emergency situations.
Hmm.
And so those are huge skills that I think have helped me be successful and help keep our patients safe. So I think communication and teamwork, and then just having the drive to continually learn more and to ask questions of the medical providers, ask them why are they doing certain things. And I think we have a very collegial relationship with our providers.
Wonderful.
And that just helps keep our patients safe, you know.
Yeah. Okay. Interesting. I've got a question here from one of our students. What was one of the hardest experiences that you've had so far as a labor and delivery nurse?
Well, labor and delivery is 98% happy, 99%, maybe 99.9% happy.
Okay.
But sometimes a mama will come in and you put the monitors on and you don't hear anything. So I've had a situation where the baby has died, and that's tragic and
Yeah.
awful. And
Oh my gosh.
it's so hard to know what to say and how to be there for them in that moment. So that's probably the hardest thing.
Yeah, absolutely. Dealing with that kind of loss, I could literally only imagine.
Yeah,
And that's
especially when it's not supposed to be a loss.
right.
You
Yeah.
know?
And what an incredible role you play for these people, though. That's amazing. That's wonderful that you do that. Now, how about on the opposite side of the coin? What are some of your happiest memories so far?
I always go back to, and it never fails, you know, like a baby will be born and I still kind of well up with tears, or, you know, kind of get that like lump in my throat. It's just so amazing. But that moment when the baby is born and the dad and the mom, they glance over and they look at each other. There's just so much love. And then they look at their baby and welcome their baby into the world. It's just to be a part of that magic. It's unreal. Yeah,
Yeah,
it's pretty special.
that's so wonderful. Uh, Now, you mentioned also before that you have a training in another area. This is you're being trained as a sexual assault nurse?
Yes, I'm in the very beginning stages of being trained as a sexual assault nurse.
Okay, and can you tell us a little bit about that? How long is that training? And I think the title is relatively self-explanatory in terms of maybe what you might be aiming to do, but can you describe the responsibilities of a trainee, or excuse me, of a sexual assault nurse as well?
I got started on this team because they're bringing that role back to Santa Cruz County.
Mhm.
So in the past, victims of sexual assault had to, if they wanted to press charges and have the forensic evidence collected, they would have to go to Santa Clara County.
Oh my
And now
gosh.
the goal is we're bringing it back to Santa Cruz. So sexual assault victims in Santa Cruz County will have some place, you know, we'll have a dedicated team of nurses and law enforcement to deal with that. So the role of a sexual assault response nurse is to interview the victim and ask, you know, let them know what their legal rights are, ask them if they want forensic evidence to be collected, and then I would go ahead and do an exam, you know, do a pelvic exam to collect evidence. And then if they wanted to press charges, we would turn that over to law enforcement. So I feel like being a labor and delivery nurse, I have experience discussing, you know, touchy subjects,
Yeah.
and we use something called trauma-informed care, where people who have been assaulted, you know, have had a lot of their power taken away from them. And so it's really important to give them back as much control and power and autonomy over themselves as possible. And that's also something that we do in the labor and delivery field. So it kind of transfers over.
Man, that's you're a very versatile person, it seems like, and it's amazing that you're applying your skill set here in such needed areas, I think,
Right.
especially in today's times. I mentioned that we would talk a little bit about
Yeah.
what it's like to be in the medical field today, literally, and more praise and thanks to you and your peers for continuing your work, right? So what is it like to be a labor and delivery nurse with coronavirus in pervading everything?
Yeah. I will say it's been frustrating because our protocols are changing almost on a daily basis. You know, at first we said only 2 visitors can come, and now only 1 visitor can come. And First it was that one visitor could go in and out, and now it's like, so it's just these constantly changing protocols. We were first told you don't need to wear N95 masks when a mom is pushing. And now they're saying, no, you do need to wear N95 masks. And so I think it's just a sign of how much we don't know with this coronavirus. So it is, yeah, it's anxiety producing, but we show up because we care about our patients, and we're dedicated to taking care of our patients. But there's definitely that frustration and anxiety. But I would say the community has really rallied. And one of the doctors came in last week with a big bag of hand sewn masks that a women's quilting club had sewn for us. And
Wow.
Nurses who are so savvy have also,
Awesome.
sewn some masks. And, we're really pulling together as a team and to care for our patients, because that's still our priority. And I would say labor and delivery is a very careful area.
Absolutely. That's wonderful. It's amazing that you're there to do that for them.
Yeah.
All right, everyone, moving forward, this is the audience Q&A time. I want to hear from y'all. What questions do you have for Ms. Julie Bailey here? Our first one, we have someone whose sister is a labor and delivery nurse. It's sometimes difficult to balance their opinion as a nurse versus the room, or in the room, excuse me. It's difficult to balance their opinion as a nurse versus the doctor who might be coming in with incomplete information, right? So how do you balance that, where you're the nurse in the room as the whole time, maybe the doctor comes in with not all of the information? How do you have a discussion with them if they try and put more weight in their say?
I want to ask a clarifying question. Do you mean the doctor comes in and is recommending a certain thing to happen, but they're not really telling the patient
Yes,
everything?
correct.
That's a good question. I think, and that does happen. The doctors come in for a split second, say their spiel, and what do you want to do? And they walk out, and the patients are like, what? So I would kind of reiterate, maybe in more layman's language, more down, with not the same jargon that the doctor is using. Um, Ask them if they understand. Ask them if they would like to talk to the doctor again, because the most important thing is that they have informed consent, that they're as informed as possible, and they have all their questions answered. And so if they don't feel like they have that, then it's my responsibility to pull the doctor in back into the room to answer those questions.
Awesome, thank you. Okay, and we have another question here. Do you do births in the hospital, or do you also go to people's homes?
I do births only in the hospital. One of the hospitals I work at is a low risk birthing center, which means you have to be 36 weeks along. And the other hospital that I work at, get anybody can come. They're not screened, risked out. So we get lots of preterm, we get twins or triplets. It's definitely in the hospital.
All righty. And here's an interesting one. Uh, when you were in 8th grade, what were you like, and what did you wish you did more of academically or personally?
When I was in 8th grade, I was a gymnast, so I spent probably 3 to 4 hours a day at the gymnastics center.
Wow.
So I didn't feel like I fit in socially as well at school, because I spent all my time dedicated to something else. I was a good student, but I was probably bothered by the fact that I felt like I didn't fit in better.
Right. Okay. They being in 8th grade, I suppose.
Yeah, being an 8th grade.
Sure. All right. And another one here. We may have to ask for a clarification question, but it's asking, do you or did you have to take blood in this job? Now, if you can clarify, are you asking whether or not Julie has had to draw blood from a patient? I'll ask that. Do you have to draw blood from patients?
Yep, definitely.
Yes, definitely. Okay. That's a specific area within nursing also, phlebotomy, correct?
Well, at one hospital, we have phlebotomists who come. They're
Okay.
the lab people. They come and draw patients' blood. At the other hospital, we don't have that, so we do it ourselves. We actually put the tourniquet and draw the blood.
Mm. Now, let's get some more questions from our students here. I've got some that I can ask in the meantime, but I want to know what you guys would like to know. So please let us know. Is there someone at your work, or maybe before your work? I'm curious who inspires you at work and who inspired you to get there.
Well, I mentioned my best friend who's a hospice nurse. She and I decided together to start the journey of becoming a nurse. So we kind of did that together. Who inspires me at work? My patients. I'm inspired by my patients.
Yeah.
To always do the best for them.
Okay. Yeah, I can imagine every day. I mean, do you ever have a patient that's in there for more than one day and maybe takes some extra attention?
Yeah, some people are there because they have for whatever reason their labor needs to be induced for safety a little bit earlier than just allowing the baby to come on its own. So sometimes the body's not quite ready yet, and we give them medications to start the process of labor. So sometimes their bodies don't respond super quickly. So sometimes those patients can be there for 4 days before they deliver, and that can be
Wow.
difficult on them mentally. Um, they want their baby to come out. Why isn't my body working right? They might think there's a lot of sort of mental, like, I don't know, anguish or distress. It's important for us to address with our patients and kind of help them along with that. So
Yeah.
yeah, and there's certain patients that have high risk medical stuff that they're definitely people that we watch much closer. For example, I mentioned preeclampsia, that's high blood pressure. Sometimes we put them on a special medication to help relieve not necessarily the high blood pressure, but help relieve the consequences of the high blood pressure, which could be a seizure. So we help kind of that way, and that's a high risk medication. So it's definitely we keep a very close eye on those people.
Hmm. Wonderful. Okay, we do have another question here actually. Uh, we've Rex has mentioned his wife has had 2 inductions at Sutter and said that absolutely amazing in terms of helping them out. But what are some ways to help expectant mothers tackle the stressors of going through the induction process?
Giving them realistic expectations that it could take a while, letting them know that everybody's body is different. You know, I think labor is one thing where we can't Google how long it will take. We can't Google, as a culture, as a
Right.
society, we're so used to now, oh, I'll just Google it. Oh, what's going to happen? Oh, it's going to happen. The funniest question I get, a baby will be born, go right on to mom, and they'll immediately ask, well, how much does the baby weigh? And I was, did you see me weigh the baby? I don't know. So we always say, I don't have a crystal ball. I don't know. Everybody responds differently, and you just have to be patient and surrender to the process, so to speak.
Sure. Okay.
Yeah.
Um, did you, was there anything you wish you knew ahead of time before you came into this field?
Not really.
Yeah. All right, good. So it
On
sounds
the
like
job, on the job training, and you grow as your competence in your profession grows. You grow and develop, and yeah.
wonderful. Where again did you get your training and your schooling?
So I just went to Cabrillo College for my nursing degree.
Awesome.
I went to UC Santa Cruz and got a bachelor's degree in language studies. And then I decided to become a teacher. I went to Cal State Monterey Bay, got a bilingual K through 12 teaching credential, and I taught for about 7 years and decided I wanted I wanted a job that I got paid well for, and B, when I was done, when I was when I walked out the doors, I was done with teaching. I always had a fair amount of preparation to do and lesson plans and grading, and I never felt completely done. Also very important for me to have a job where it was meaningful. I felt like I was truly helping.
Okay, wonderful. Well, and so that unfortunately we're getting close to out of time here. So if we have one last question I can ask, and it sort of goes with my general last question in terms of I want to know what sorts of advice might you have for our students listening and anyone trying to get into this field. What can people do if they want to start pursuing a career in nursing?
You can volunteer at your local hospital. You can take lots of science classes. The CTE, so a little plug for CTE. I know they have a great class called Healthcare Professions, something along that line. They also have biotechnology, and those are great ways to expand your knowledge of the medical profession. Take lots of science classes in school. And just know that there's more than one path you can take. You can get the 2-year degree, the 4-year degree. You can change your mind after you've gotten a degree and come back to being a nurse. You can look into different like summer internships at Stanford University. They have quite a few in the healthcare profession. Yeah, but just get out there and see if you like it.
Wonderful. Thank you so much for doing this for us today, Julie. This has been an absolute pleasure, and I couldn't appreciate it more.
Yeah, it's been great. If I can inspire one person to be a nurse, it's the best thing I've ever done. So.
All right. And thank you to all of our listeners who are actually listening to us live. I almost can't believe it. Thank you so much for tuning into today's career story. I'm Jacob Scheckman. This is our show, What to Be, with today's guest. Julie Bailey is a registered nurse in labor and delivery. If you guys have any questions or would like to share any other career stories with us, please send us an email at whattoberadio@gmail.com.